Pop quiz. A nurse is caring for a client who's been prescribed valproic acid for seizure management. Which of the following laboratory tests should the nurse monitor regularly to detect potential adverse effects of the medication? A, WBC, B, potassium levels, C, LFTs, or D, thyroid function tests? And guys, the correct answer is C, LFTs, your liver function test. So here's the thing. As you can see, this type of medication, valproic acid, it is an anticonvulsant agent. It's actually the drug of choice very often for pediatric patients that have seizure disorder. But anyway, when it comes to adverse reactions, remember guys, I tell you all the time, there is a difference between side effects and adverse reactions. Side effects are things that you're going to warn the patient may potentially happen if they take the medication, so they're not surprised. We're not going to really change their medication. The healthcare provider is not going to change it. We warn them. Adverse effects are things that may possibly happen if the patient takes that medication, and you warn them. If you experience any of these, you have to let us know right away, because you're going to expect the healthcare provider to either change the dosage or maybe augment the medication somehow. So anyway, we're talking about adverse effects of valproic acid, which is, again, an anticonvulsant agent. Now, when it comes to drugs across the board, not only this one, if you have no idea what the answer is and you're looking for an adverse effect, think about this. Any drug you take, it's going to affect two organs: your kidneys, your liver. Why? The kidneys are responsible for excreting that medication from your body, so your kidneys are going to have to work hard to do that. Your liver's responsible for what? Metabolizing that drug. So if you have no idea what the answer is and you see something that has to do with either the kidney or the liver, take your chance and choose one of those. In this case, it's liver function test. By the way, with this drug, if that liver is affected, usually what will happen is we'll see an elevation in the LFTs at the beginning of therapy, but as the person's body starts to get used to that medication, it'll drop off. It won't be as bad, but we tend to see that towards the beginning, okay? So that's why liver function test is the correct answer.